Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just tuning in, Dr. Lom from ExpressCare is answering viewers' questions which were submitted online. All right, Doc, are you ready for more?
Ready for more.
Okay. So our next viewer is asking, I've read online about a new hyped treatment to whiten teeth using activated charcoal. What is this? What are some procedures or products that I can use to whiten my teeth?
Okay. Well, everybody's born with a natural color of enamel. When you're a child, that's the color that you're given, just like your skin color. So you can only go up to that level of whiteness. But activated charcoal is a substance that actually picks up random sort of pieces of a contaminant on your plaque, just like we use it for, let's say, unintentional poisoning. We use activated charcoal that you swallow. You can brush your teeth with it. It's incredibly messy. It's like black tar, and you have to brush your teeth with it for about 7 minutes, and it's quite messy. And afterwards, your whole mouth is sort of black, and you have to rinse and rinse and rinse, eventually get it off. But it will whiten your teeth. It is quite harsh. Another thing that you could do is use baking soda. Again, very abrasive and quite harsh. I don't recommend it. I think a good place to start is seeing your dentist for a good cleaning, and then prevention. Let's not drink too much caffeine. At least if you do, brush your teeth right after, rinse off, so that you get those enamel staining materials off yourself. We do offer teeth whitening as well as at our clinic. You can also buy whitening strips. There are so many ways now to have beautiful white teeth.
Okay, now are the whitening strips safe if a person uses it over and over again, or does
your dentist can advise you, but they are relatively safe. You have a risk of developing tooth sensitivity from irritating the enamel too much, and then you need to back off.
Okay, now our next viewer is asking, is it dangerous or encouraged to work out while pregnant?
Oh, please exercise while you're pregnant. The women that do so have a much easier labor, a shorter labor, less bleeding. Overall, they're healthier and they're fitter. They're able to handle the demand of labor and delivery much more easily. Now, it's not a good time to try an extreme workout program. If you're already fit, just keep doing what you're doing. If you're just wanting to start doing something, take a walk every day, 30 minutes, do a Zumba class, do something very light and fun for yourself and your baby.
I have a friend who, she's in the military and she, works out, and she was just telling me, oh yeah, I was doing push-ups and sit-ups, and I was like, push-ups and sit-ups? Are you crazy?
If she's used to it and her body's already accustomed to that, she's fine. Babies are very well protected. Where you wouldn't want to do something extreme is like a marathon, or something where you're going to get very overheated, or some kind of extreme, kickboxing, something like that. But regular exercise is really very healthy.
Okay, I can go home and tell her, okay, you're fine.
Yeah, you're okay.
Now our next viewer is asking about Botox treatments. I hear Botox treatments may help with migraines. Is this true? And if so, how?
It is true, and we use them oftentimes. There's many uses for Botox, but migraines are one of them. People that suffer from tension in the back of their head or migraine headaches in the front often have very large developed muscles of the scalp. And that's because they're using them and frowning and clenching. And when you clench any muscle, it can start to get very tight and painful. And that can be one reason why people are getting migraines. So by injecting Botox, which is painless, we allow that muscle to relax. And then it can't clench and they feel more comfortable. Sometimes we'll put them right into the scalp or in the back. We also use Botox to help people who have teeth grinding problems. Too much tension here in the jaw during the nighttime, and pain and headaches when they wake up in the morning. So we put some right in here, about 3 injections on each side. After about a month, everything has calmed down.
Okay, now once you start getting Botox, do you have to continue to get the Botox? Or
not at all. This is a treatment that will last 3 months. You can use it as you wish. If it's helpful to you, great. If you wish to continue, you can. If you don't have to. Nothing bad will happen to you. All it is doing is it's relaxing muscles for a period of time.
Oh, okay. Now, our next viewer is asking about vasectomies. Is a vasectomy reversible? And if so, what is the success rate?
Right. So vasectomies are reversible. It depends on whose hands you're in as far as your surgeon and how many he has done, or she, and also the technique that they use. But when they use microvascular technique, basically using it under the microscope, the success rates can be very high, over 90%. The full outcome is known about a month after the surgery, where a sperm test is done to see if it's coming through. But they are costly. They run about $5,000, and I don't know if any are done on Guam here. I'm not aware of that.
That's interesting. All right. Now our next viewer moves on to pinched nerves. How does a pinched nerve occur?
Well, there are different places that you can pinch a nerve. We call them peripheral, meaning far away from the center of your body. For example, carpal tunnel syndrome is a pinched nerve problem where the radial nerve is traveling through the arm, through an area of your wrist, and then there's too much in there, bones, fat, fluid, and it's pinching on it. Okay, that's one area. And typically we also hear about pinched nerves in the spine, right? When somebody has, let's say, lifted something very heavy or sneezed or laughed or had some kind of trauma, where one of the discs that is the shock absorber between the bones of the spine, you have the disc shock absorbers, slips a little bit and pushes and pinches on a nerve, and then people start to get pain radiating down their leg, usually past the knee. That's a very important symptom. Generally they have back pain with pain that radiates past the knee, and they may have weakness and it may be very uncomfortable, and then they would need surgery sometimes for that. So there are different ways that you can pinch nerves. It's hard to prevent them from happening. The only thing I can suggest there would be, again, weight control, because if you don't have additional weight, there's less strain on your back and even on other parts of your body where you could pinch nerves.
All right. Now well, actually, that's all the time we have right now.
Okay.
So thank you so much.
You're welcome.
Doc.
You're welcome, and Merry Christmas.
All right. Merry Christmas to you, too.
Thank you.
And you are definitely going to want to watch next week's show, because not only is it the last one for 2014, but we will be talking about New Year's resolutions. We'll be back to wrap up the Healthy Living Show when we return.